Welcome back to Midday Kentucky, everyone. If you're interested in a career in healthcare, you need to join Kentucky Healthcare Training at their open house. Joining me today to discuss the open house is Dr. Don Gash. And welcome to the show, Doctor. We appreciate it. And we also have Mahogany Dobbins here, too. And you are the Student Services Coordinator, correct?
Yes.
All right. Well, welcome to the show, everyone. Now, okay, first of all, tell us what it is exactly that you do.
Okay, what we do is we train students who want to enter healthcare to be how to become a nurse's aide. It's entry level. It is sort of the base to get started, to learn how to deal with patients, to take care of patients in an appropriate and compassionate way. And the training involves both classroom skills and clinical.
Okay. So they get hands-on experience.
They get hands-on experience. They have to take a state exam and can become a state registered nurse's aide. There is a tremendous need in the community, from the hospitals to the nursing homes to the assisted care living centers, for individuals with these skills. So there are a lot of jobs out there.
Right. And we were talking, and you had considered this an entryway to the healthcare, as far as a healthcare career. Can you talk about that a little bit more, too?
Oh, certainly. We have individuals who have not even graduated from high school up to people who are pre-med and have already been accepted into medical school that take this training.
Gotcha. So
it is sort of the basis for starting to work with patients, to figure out how to do it, and whether it is really something that you really want to do for the rest of your life.
Right.
But you start there, and then you can start going up the ladder. We have individuals that go ahead and become nurses, physician's assistants, physical therapists, occupational therapists.
Very good.
Even x-ray technicians, and then on up into medical school.
So this really gives an individual, especially, and I'm thinking, you know, young folks that are graduating from high school, maybe not have a real solid idea of what they want to do with their lives at that point, maybe not thinking that college is really what they want to do yet, at least.
Right.
This is a great way for them to get, you know, some experience in the healthcare industry, because not everybody can handle that industry. That's not really cut out for everyone. So it's really, sounds like it's a great opportunity for the people to be able to get in, see if, you know, if this is, you know, especially if you're a compassionate person. I would imagine that those are who you're trying to recruit with the organization. Now, let me ask you this. What are the qualifications that someone needs, Mahogany, in order to qualify for this type of a program?
Well, for the SRNA course, you can be 16 with parental consent. For our CCMA, phlebotomy, and our EKG tech course, you have to have a high school diploma or a GED.
Okay.
And be at least 18.
Okay. So, I mean, you know, and they're pretty much ready to go. And you guys offer a lot of consultation and support for a lot of these students, correct?
We do, and we have a number of recruiters that come to our classes from all around the community. Again, there are a number of jobs out there. In fact, the career field itself in healthcare is expanding. The estimate is about 20% for next year.
Is it really?
So there's a big need out there. And for someone that's just getting out of high school and not sure, here they can earn $12 an hour or more just to get started.
Right.
And then it goes up from there.
Exactly. I mean, it really depends on the individual. If they really want, if they have the need and desire within themselves to want to move up the ladder, they can. Or they might be very happy being a nurse's aide and working with patients every day, day in and day out, with those type of duties as well, I'm sure.
Right, and what I've seen is it's so important for the patients to have compassionate aides in there.
Right.
These are the people that spend more time than the doctors or the nurses with the patients, and to have someone in there that is careful, caring, compassionate, can make a real difference in health and in healing, quite frankly.
Yeah, and we all know that that's extremely important in this industry, too. But thank you very much for both of you coming, and we have your information up on the screen as well. For anyone who might be interested, I know you're recruiting right now. And these classes, are they, it's a 2-week course, is that right?
The shortest course is 2 weeks.
Yeah.
And it can go up for 4 months, depending on what people want to take.
Well, if people are definitely
But
interested.
in 2 weeks, they could be get the training, they could get take the state test,
Gotcha.
and be out employed, working in the community.
Gotcha. That's awesome. Thank you so much, Doctor, and thank you, Mahogany, for being here. And we have more Midday Kentucky coming up right after the break. Keep it right here.